available to talk and to help with your business needs as we move forward. So let me get my slide going here, and then we can move into the formal presentation. Obviously, the slide I want to show, I don't see here.
If you want to toggle over, James, and open it and then hit share, that works sometimes. If you have more than one thing open, it might not pop up as the first one.
Yeah, it's fine. Now it's not even
You
popping
just
up at
had it.
all. Oh, it did? So sorry.
That's
We
okay.
even rehearsed this at the beginning.
So go down to the green share screen button.
Have it
Yeah.
now. I
Got
am
it?
so sorry.
No problem. You got it. It's good.
And now I just have to go from the beginning. I apologize, everyone.
Now you're going to go to your slideshow and say start from the beginning. Yep.
Yep. Great. So thank you so much. Sorry for the delay here. So again, let me move on with the presentation. I knew that was going to happen, so I apologize, everybody. So again, on behalf of New Jersey Department of Labor, I have a quick presentation to talk about some of our initiatives that we have in New Jersey Department of Labor. Our agenda includes, again, we already did the introduction, and my colleague Howard Miller, as I mentioned earlier, who's on the call, he will be available at the question and answer period to directly answer any questions that may be available, as well as myself. So I'm going to review our business services unit, the various business services that we offer to businesses throughout the state, talk about registered apprenticeship programs throughout the state, and what is registered apprenticeship and how to create one for your business, discuss some funding opportunities, and again, we'll have some questions and answers at the end of the session as well. So with business services, we kind of have a holistic approach as far as business services. So providing a quick overview of our system, I mentioned earlier, the service that we offer is inclusive of just the whole workforce system itself throughout New Jersey. We have our one-stop career centers as well as our workforce development boards throughout the state as well in each county. And our whole intention is to provide a holistic approach to employers to serve your needs. That could include your talent acquisition services, any training needs that you may have to fill those skill gaps that you may have as a business, labor market information to help really craft where you may want to expand or move your business in New Jersey, grant opportunities, as I mentioned, and as well as registered apprenticeship. So that's kind of a high level of the different services that we offer. I'm going to go into a little bit more detail as we move through the process here. So again, our business engagement unit, we help out with, as I mentioned, we help with our job posting and skill matching to ensure that that the businesses have the employees and the needs that they have to hire individuals. We connect employers and industry to the workforce system and move your business forward and meet your needs. We have our local area partners, as I mentioned, the one-stop career centers and workforce development boards. And our network in New Jersey Department of Labor business representatives provide what we call a concierge-like service, providing employers and directing employers to resources that will meet your business needs. So when our business rep does come out to your location to discuss your needs, we look at your short-term goals as well as your long-term goals, right? So if you have an immediate need, for instance, as I mentioned about job posting, if you have to hire and you have openings within your company, and you like to hire individuals, we do have a network that we can partner with our one-stop system to match what skills you need for those that employment, and match those individuals that may be able to meet that need as well, right? So you can hire those individuals. The employer ultimately has the ultimate right to hire anybody who we do refer. We can also assist with job fairs, provide training needs assessment, meeting with your company. We can review the needs that you have for training, see if there's any immediate needs where you can connect it to any training providers throughout the state, or even help develop training within your own company. One way we train, which I'll talk a little bit later about, is as far as registered apprenticeship. That's one way to help meet your training that's needed, as well as your recruitment efforts as well. Our labor market information can provide wage and employment information. Not only does that help, again, as I mentioned earlier, help possibly if you're looking to relocate within the state of New Jersey, but also gives the characteristics of the workforce within the county or the regional area in which you are located. And also that labor market information helps us as New Jersey Department of Labor, based on the input that we receive from employers and industry, to decide what programs we fund and to really set the stage for our funding each year throughout the state. So, and also with the labor market information, that may help as well as define what your wage rate might be for any openings that you have as well, to help make sure you're competitive with the wage rates within the state of New Jersey as well. And then lastly, connection to New Jersey Department of Labor funding training opportunities. So I'll talk a little bit more in specific about the different programs that we do have, but we have what we call competitive grant opportunities, which include which are issued through notice of grant opportunities. When I talk about that later, it'll be a little bit more clearer. But in addition, we also have some business service incentives that we have, which include OJT wage reimbursement. So it's really based on the individual. There's eligibility that's required as well. And I won't go into all the eligibility requirements, but there is potential if you have a need to hire individuals within your company, where we can provide an incentive, which is a 50% wage reimbursement for the wages that you pay for a new hire in your company as they become productive in your company and are newly hired as well. We do have a team of, again, dedicated professionals within our OJT team, which could help evaluate if your company would be able to benefit from a company such as that. So I'll move on to the next section. So in addition to the business services that we offer directly to the employers, we also have our New Jersey Industry Partnerships unit as well. So our New Jersey Industry Partnerships is a vehicle for mobilizing business leaders from specific regions to collaborate with public partners in resolving workforce, economic, and education challenges impacting New Jersey industries. So it is led by business leaders to ensure the system is truly demand-driven, and which would yield better outcomes. It's organized to align resources at one shared table, with education, workforce, and economic development partners at the table. And also is focused on a single industry to allow business leaders to engage directly with industry peers across traditional boundaries. And it is driven, as I mentioned earlier, by business leader priorities that go beyond the basic workplace skill needs to build sustainable talent pipeline, but also connecting and diving deeply into the technical and supply chain needs as well. They're established regionally to address the dynamics of local economies and identify common issues, challenges, and opportunities across employers. So you may have employers that are competitors to each other sitting at the table, but the whole goal is to really look at, as an industry, what are some of the needs of the industry, right? That could be, finding qualified employees, maybe having an apprenticeship program that may benefit various or multiple employers within an industry as well. So as we go through this next gen sector model, this is the next gen sector strategy model is a model that New Jersey has embraced. Again, to provide the model to build industry-driven partnerships across the state. So you'll see we have the business champions at the table, and actually I should move back to the last slide, I'm sorry. In that slide there, you'll see the business champions at the table as well. Those business champions really lead the idea of collaborating with peers and public partners to tackle those industry issues. We have the business leaders that include the business decision makers, right? The CEOs, the owners, who seek to address industry changes and challenges in collaboration with industry peers and public partners. The convener is New Jersey Department of Labor as a public partner to provide project management and help facilitate. So New Jersey Department of Labor would be at the table as well, but more as a convener and really to help assist the process. We don't dictate, we don't tell you what to do. It's really the industry saying what industry needs. And we're there as a partner to supply support and direction to help everybody through that. And again, the community of public partners are at the table as well. That could include workforce development, economic development, education, and other key areas to work collaboratively to address the needs of those partners that are at the table. I will now move on to the next slide. And this slide, again, as I mentioned, is industry driven. It's understanding workforce barriers to make industry more competitive and ultimately the employers more competitive. Building a talent pipeline, making sure your employers receive the training that they do deserve, and that to make sure your company is more competitive with the right training. It's sector and region based. And again, a community of partners, I mentioned, all the partners around a table, around one table with one common message and one common intention of moving forward. So that gives a good overview of our industry sector strategies unit as well. Now moving on to registered apprenticeship and funding opportunities. So registered apprenticeship is registered apprenticeship is really just a training model. It's a training model that's been around. Boy, we just celebrated, I believe, the 85th year of registered apprenticeship in the state, not only in the state, across the country. So it's a U.S. Department of Labor focused training program, but it's an industry-driven and structured training program that allows an apprentice to earn while they learn. A minimum of 144 hours of related technical instruction, otherwise known as classroom training, is required for each year of the registered apprenticeship program, as well as 2,000 hours of on-the-job training, which is learning, which is for each year of the occupation. So the occupation is based on the length of the registered apprenticeship training would be based on the complexity of the job, which would dictate the length of the registered apprenticeship, which could be from 1 year up to 5 years. So usually when you think about registered apprenticeship, you think about the building trades, right? Carpenter, roofer, electrician. So those occupations have been traditionally focused on registered apprenticeship. We made great strides over the past 6 years under the leadership of our Commissioner, Robert Cerro Angelo, as well as our Governor, Phil Murphy, in really expanding apprenticeship into non-traditional sectors. And direct care, child care, healthcare, and other industries are really what we're trying to focus on expanding, and we have had success doing that as well. So some of the benefits to registered apprenticeship include quality standards. So those standards that I talked about, 2,000 hours of on-the-job training each year, as well as 144 hours of related technical instruction, right? Those are quality standards that are dictated by industry. So when an occupation is approved, industry is dictating what that length of the registered apprenticeship program is going to be, and will dictate the structure of what training will occur during that registered apprenticeship training. We have found across the country that it does increase the workers' productivity. We believe when an employee is hired into a registered apprenticeship program, and just to be clear, too, registered apprenticeship is full-time employment. So, and they're productive. So when someone is hired into a registered apprenticeship program, they're productive from day one. They become more productive as they progress through the training program, but they do increase their workers' productivity as well as their commitment to the employer. We found that over 90% of registered apprentices that have completed programs do stay with that employer. And again, we do hope that there's a career ladder. So when they do start in an entry-level registered apprenticeship program, that they do transition to other careers within that company. But again, over 90% have been found to stay with those employers once they complete the program. And it does build the company's skills base as well, right? It does build the knowledge of the company, the competitive nature of the company, and that employee feels more committed to staying with that company because they see the investment that the employer is making into that individual. So this is some of the apprenticeship by the numbers for the state of New Jersey. So over the past 6 years, since January of 2018, now about 6.5 years, currently we have over 8,700 active apprentices in the state. That's up from 6,783. So we have almost 2,000 new apprentices that have been hired since about 6 years ago. And the number of registered apprenticeship programs in the state currently is at 1,376 registered apprenticeship programs. That's up from 611. So you'll see since January of 2018, we've registered 765 new registered apprenticeship programs, which has more than doubled the number of programs in the state. Over 18,568 new apprentices have been hired since January of 2018. Over approximately 9,400 new industry recognized certificates of completion have been awarded by U.S. Department of Labor. And again, looking at the data from the last quarter of 2017 to currently, again, there's about 1,955 new apprentices, active apprentices that accounts for about a 29% statewide increase in registered apprenticeship overall. And I should state, and I should have stated this earlier, registered apprenticeship is a U.S. Department of Labor approved training program. New Jersey is a partner in that, while U.S. Department of Labor is a registering agency and oversees all the apprenticeship requirements. New Jersey Department of Labor is a partner in that. We provide obviously funding through our competitive grant opportunities and also through our employer engagement units. We do help employers through the beginning of that process of becoming a registered apprenticeship sponsor. I'll talk a little bit more about that in a few minutes as well. Financial incentive programs. So we do have a couple of key programs that we have for financial incentives related to registered apprenticeship. Our growing apprenticeship in non-traditional sectors, otherwise known as GAINS. So if you're an employer and you're going to, whether you have a current registered apprenticeship program currently, or if you're creating a new registered apprenticeship program, our GAINS funding can help offset the training costs for those new apprentices. So that training, the training costs can be reimbursed for all those apprentices that are going through your program. So be it the hands-on classroom training, the hands-on OJT on the job learning that's occurring as well. We can provide some financial assistance to the mentors that would help mentor those registered apprentices, and also some administrative costs as well. At the end of the presentation, we have a link to our New Jersey Department of Labor website that you can look at all the competitive grant opportunities that we have there, GAINS and PACE. We go by the fiscal year, so our fiscal year is getting ready to end at the end of June. So I would anticipate in our new fiscal year, FY25, probably around September or so, we'll start rolling out some of our competitive grant opportunities down the road, but you can always reach out to me specifically or my team for more information. The Pre-Apprenticeship and Career Education, otherwise known as PACE, is a pre-apprenticeship program to help prepare individuals for placement into a registered apprenticeship program. So we have a lot of some high schools, we have some community-based organizations, labor organizations, employers that have PACE programs to help prepare individuals. It's like workforce readiness training with a little bit more focus on the industry and on exactly what the occupation is to help prepare somebody to go into that occupation. I mentioned earlier, we have on-the-job training, wage reimbursement incentives as well. We have one program for registered apprentices, as well as another program for employers in general. And we also have our upskill program, New Jersey Incumbent Worker Program. That's kind of our customized training program. So that trains incumbent workers in the state of New Jersey, and that helps support employers that need to upskill their incumbent workers. So that could be a new piece of equipment that you may have obtained. It could be a new model or new train that you need to roll out to all your employees. So that upskilling program could help your company with reimbursing or help assist with training of your incumbent workers to make them more competitive. I'll go quickly through these slides. I have two slides to really talk about the investment in registered apprenticeship that we made over the past 6 years. So you'll see that we've had by fiscal year, we've awarded each fiscal year for the past 6 fiscal years through FY24, over $71 million in work-based learning grants and apprenticeship grant funding that we've awarded. That's projected to serve about 11,000 individuals. And again, by program, you can see the investment that we made through our GAINS and PACE. And we have a couple other programs too, YTW and NJ Build, that rolled into that $71 million allotment that we've had. So I would anticipate going into FY25, we're going to probably have the same level of investment, roughly $10 million towards our apprenticeship, NJ Build. And actually, I'm sorry, it's probably going to be closer to $20 million with NJ Build and our GAINS and PACE. And also on top of that, the investment that we make through our upskilling program as well. And then I just wanted to, we have my email address, James Manning, again, with the Apprenticeship and Business Services Unit. Howard Miller's email address is on here as well as our contact phone number. And at the end, at the bottom, we have our link to New Jersey Department of Labor website. So when you go to that website, you'll be able to, it brings you to our business services team website, and you'll be able to navigate from there to our competitive grant opportunities. What I will do, I'll share with Kathy and Jake after today's session. We have a couple of marketing one-pagers about our grant programs, which I will share, and maybe we can have that distributed to everybody who's on the call today. And I just want to take a moment and say thanks again for the opportunities to present today. Thank you.
Thank you, James. We do have a couple of questions in the chat, which I want to ask you, and then Jake is going to give an update from in another area. So But one question is, how does this program work with the requirements for certification for CNA and home health aid? Will we be answering that with the next speaker, or do you want to take that question now?
Well, I can ultimately, there are what they call standards that are developed by U.S. Department of Labor currently. Um, so I think it might be a little bit too. It's really based on the employer's need and making sure it's the right occupation. So I'm not really the expert to go into that level of detail, but we can connect with U.S. Department of Labor. Anybody who's interested in that, and we do have registered apprenticeship programs in CNA and those various occupations. But our employee engagement team can start that conversation. We can kind of connect it to U.S. Department of Labor to we could go a little bit more deep with that. But we make sure that whatever those state standards are. I know sometimes there's certifications that are required and different steps along the way. We make sure that that doesn't block you from going to a registered apprenticeship and making sure that your program's still formalized, even with those certifications that are required as well.
Okay. All right. And I think some of our provider speakers will get into more details on that when they speak. So Jake, I'm going to turn this over to you.
Thanks, Kathy. We're about to introduce the panel, but one of our panelists today wasn't able to make it at the last minute. So he asked me just to talk a bit about the notes he had wanted to share with everyone. His name is Chris Capobianco, and he's the Director of Training and Workforce Retention at Home Instead. And Jim, if you don't mind, just because Jim has worked with Chris previously on this apprenticeship project, if you could just talk about a little bit about the context you know of for Chris's work.
Absolutely, sure. And I met Chris, but now it's over 5 years ago when we first rolled out the Gains program. And Chris is with Home Instead, which is a franchise company. And he at the time had a Home Instead franchise himself. And we talked about developing a program to help out with developing his workforce as well, creating a registered apprenticeship program. And as I'm speaking, I'm just trying to find the actual occupation. And here we go. So it is home health aid, but it was focused on dementia care. So when he first started, we had the first conversation. He knew nothing about registered apprenticeship about 5 years ago. And we talked about the model, the apprenticeship model, how the home healthcare industry can have a little bit more formalized training in alignment with industry standards. So he did create a registered apprenticeship program for his company at the time. It's been expanded to other Home Instead franchise owners as well, who kind of Chris has spoken to and signed on as well as sponsors. And a sponsor of a registered apprenticeship program is the employer or other organization that's really monitoring and managing that registered apprenticeship program. So over those 5 years, he's been a grantee of ours through the Gains program on and off, probably serving over 250 new apprentices that have been hired through his company or other companies. And it does have that dementia care specialist as well with that home health aid occupation. So he's been really an advocate. If you're thinking about creating a registered apprenticeship program, especially within the healthcare industry, Chris is willing to speak to anybody. I know, and it's unfortunate, due to the death in his family not being here today. But I know down the road, Chris will always be available to talk about developing a registered apprenticeship program. There is a process with U.S. Department of Labor, but that's why our New Jersey Department of Labor Employer Engagement Unit really assists and kind of is with you side by side to help go through some of the paperwork at the beginning and do that job matching and figure out what occupation is best for your company. And then when U.S. Department of Labor gets involved in it, that's when they do the ultimate approval and signing of the documents and everything. So it's been a seamless process pretty much. I know Chris has mentioned the return on investment because he has a much qualified and a much better trained employee that's trained consistently with the standards that are developed with U.S. Department of Labor. He's found that the retention has been very high about retaining employees once they complete the program, and makes them a better employee because they're more skilled and knowledgeable about the industry and the company as well and the job. So he's really found it to be very helpful. So I think if anyone's interested in talking to Chris one-on-one, I know he'd be willing to do that. So thank you, Jake, for the opportunity to kind of kick that conversation off.
Yeah, thanks, Jim. And Yeah, I'll be curious if our other panelists have any responses to Chris's points here that he wanted to make. But first, he just wanted to talk about what he's using the apprenticeship for. And the main thing is that he believes it offers really great career level advancement opportunities to home health aides. He uses it to identify and train home health aides that already work there to enhance their skills. Folks who are in the apprenticeship receive 76 credit hours towards their CHHA certification. The apprenticeship also provides 49 hours of specialized dementia care training. And then upon completion, the apprentice gets a certified dementia practitioner, which is a nationally recognized certification. So hopefully it has some portability both within the state and even outside the state. The apprenticeship also provides 30 hours of what's called enrichment training. So that's home health aid skills, CPR and first aid certification, cultural competency, senior nutrition, dietary needs, engagement activities, communication strategies, swallowing techniques for people with dementia. So kind of a whole host of additional bits of training. And those are provided along with the dementia training through partnerships Home Instead has with other community organizations. So Home Instead generally isn't providing this training itself. Instead, it's partnering with other groups to do so. Chris then mentioned the pros and cons he saw to the apprenticeship program for home health aides. On the pro side, he thought it kind of elevated and attracted direct care workers to work at Home Instead. There's higher pay for people in the apprenticeship program. Hearing back from the apprenticeship, people who have taken the apprenticeships, they've said that they really value the knowledge that they've gotten, and they have higher job satisfaction. They have higher retention, and they're more engaged in the company afterwards. Chris also thinks that it improves the quality of care that his folks are providing to the patients. On the con side, there's time invested in having to organize these group trainings, especially as those same workers are the ones who need to care for clients. So how do they maintain their client care schedule while also trying to have these group trainings within normal hours? Also, apprenticeships need to be full-time employees, and the partner organizations they work with may max out on the number of eligible candidates. And especially with home health aides, a lot of folks just aren't full-time employees. Chris then had two other pieces here. One was just some tips for how to make this work if you're interested in trying this. One thing is to get a program manager or some kind of intermediary between the company and the workforce to try to oversee and administer and kind of act as a liaison with the organizations you're trying to partner with to do the training. Another tip is to really get buy-in and support from these community organizations who are doing the training, so that they really know the benefits the workers are going to get from this and that it's worth their time. And the third tip was to be clear in the selection process for apprenticeships. So make sure the workers know, like, what are the requirements and who's eligible, and to show that it's like fair and that it's open to who should be open to. And lastly, Chris mentioned two potential barriers he saw that might be problems folks run into. One is just convincing partner organizations to work with you. And his suggestion there is to really start at the top. So start with admin at these partner organizations to find folks who can provide this type of training. And then having somebody at your workplace who can handle the timely reports that you're going to need to put out as part of this process. So making sure you've identified that person. So I'm actually, I'm not going to pause to take questions because, again, I'm not Chris and I'm just reading his notes to you all. So I'm sorry, I won't be able to answer your questions, but I'll leave my email in the chat and I'd be glad to connect any of you with Chris. And then lastly, Jim, while we have you here, I did want to pull out that Julia had asked a question in the chat, and she was wondering if you at the DOL had included the direct care workforce in any of your prior training assessments or other labor market assessments.
So specifically, the labor market information, we have a research information area that focuses on the labor market information. So I'm going to be honest, I'm not really tied to that unit, but I know that as far as a Department of Labor, we're focused on the care economy, we're focused on the healthcare economy, we're expanding apprenticeship into various occupations throughout the state. So yes, there's been needs assessments, there's been a greater need by the healthcare industry overall to have registered apprenticeship be the model they want to be part of. I can obtain more information through that, and I think our partners at U.S. Department of Labor might be able to help out with that as well. I will, well, at the end of that PowerPoint is my email address. I'll put it in the chat as well. If you want to reach out to me directly, I'll try to connect you to the right individuals to maybe answer it a little bit more detail.
All right, thank you. Thank you for pinch hitting, Jake. So we're going to now have our provider presenters, and we're going to start with Cheryl Morris. Cheryl and Lauren have been very, very active members of our workforce, our coalition workforce committee. And we spent about 18 months talking about every challenge, hurdle, and possible solution we could think of for bringing more people into this field. So Cheryl, okay, we see your screen. Go ahead.
So good afternoon. I'm Cheryl Morris. I am from Masonic Charity Foundation, but it's also known as Masonic Village at Burlington in Burlington, New Jersey. This week is our birthday. We will be 126 years old. So we have 400 team members that work with us, and a combination of skilled, assisted living, memory care, and independent living, over 400 residents. I agree everything that Chris gave on feedback. Our champion hero for the apprentice program was our human resource assistant that worked really hard on this program. She's now gone on and gotten promoted from an assistant's position to a generalist. And actually, this is her presentation I'm sharing. You're also going to see funding from different grants that we did along the way in the last couple of years that are no longer. And Jim, I know we got a lot of benefits out of different funding from New Jersey. So let me see if I can get my PowerPoint to move. Wouldn't that be wonderful? So here we go. So I'm going to go over accomplishments, what we did for our team members, how they participated, what the incentives were, what kind of things we used. And the best part was the celebration, which I'll talk a little bit about. So we had 30 apprentices enrolled with LPNs and CNAs. We had cooks, which was a very successful program that I'll share. And then we're currently on an existing apprentice who's now going on to get their certified dietary manager that took one of our cook programs. We earned over $85,000 in 2023, and we're probably going to earn a lot more in 2024. So we did have incentives to do this. And again, this was a different funding, but it was great. We got transportation support and equipment support. One of the requirements is that you give a merit increase to the apprenticeships for completion. It was $1 increase. And you could split it up with your regular merit increase as well as adjusting when they completed the program. And they received an actual full certificate from the Department of Labor, which was really nice. Clinical, what we did to get people to participate, we talked about it as a career advancement program, not as an apprenticeship program, because a lot of people hear that and get the wrong assumption. So we were looking for people in clinical that were looking to expand their roles and grow with the organization. So we had meetings to discuss what the benefits of the program was, to ensure that, cover all the shifts that we have, because we're 24/7 in the organization. And we did, flyers around the building, web and email blasts. And then we had several computers that we set up for the apprenticeship application to help them register, and we were here at all different hours of the night and day. For the clinical program, they just had to do their existing education that was required, and because we're funded by state and federal, there's certain requirements that we have to meet. And so for the nurse programs, that was really nice. So they had to do their 12 hours of Relias for both the LPNs and CNAs. For the culinary apprenticeship, we discussed in their lineup meetings twice a day. Supervisors actually participated in the program because it was a course through Culinary Institute of America, or CIA. For those that know the cooking school, it's famous and it's very impressive. So they got to take that. It was through the SAS program that they studied. And they had quite a lot of things to take. I remember the apprenticeships talking a lot about the different classes, and they were on their own pace for a year to do this. And as I said, we had somebody that completed that program that's next going on to the next step. With gains, we had gotten about $2,500 per person for about $750 per hour for on-the-job training reimbursement. For related technical instruction, we had gotten reimbursed for our apprenticeships of $750. The team member morale was amazing doing it. Team members really enjoyed it. We used any extra funds to reward the team. And we used, as I said, with merit increases, and then to make sure that we gained. And as you know, cooks were hard to keep during COVID. And we kept having a shortage of cooks. So when they participated in this program, a lot of them were existing team members, and they moved into different programs and really enjoyed this. So career advancement program, this is some of the slides and the PowerPoint and flyers that we did. The requirements they had was high school or GED equivalent, maintaining good performance, and complete the training and competency. They got a merit increase at their midway point from completing their training. They had funds available from different grant funding in their time of need. And they was additional training in a pathway of your choice and assistance throughout your training program. So this just shows we did an apprentice acceptance. So they, certified for us that said, I'm 18 years old, I have a high school or GED equivalently, and I can legally work in the United States, which was part of the requirements. And then this is some of the invitations we sent out to talk about the different programs, how they can get more incentive and more money, as well as a career advancement. With the cooking, we did focused on food, as you can see, and it was a one-year program that their tuition was paid, and they got a lot of other perks. And then we explained what it was to advance your career, strengthen your knowledge. And then what do you get out of this program? Because that's what the team wanted to know. You get an increase twice during the program. You get a certificate of apprenticeship completion from the Department of Labor. You get skill development to your career and access to training modules. And again, here is the other. We've actually done 2 years in a row of the apprenticeship program with the cooks because it was so popular. And then we did congratulations when they were accepted into the program. And then we actually had a celebration graduation when they were completed. And this was it was very heartwarming. Some of these people, you could tell, never went to college or really didn't show up for their high school graduation, and they brought their friends and family. And it was like we were doing a big formal graduation for them when they finished the program. And then we talked about how career advancement will help them in the program and what they're learning. So this shows you some of the pictures that we had, and we celebrated and put their names out there for the completion and the smiles, and then we gave them a graduation certificate. So let me get back and stop sharing. So I didn't know if anybody had any questions. I have questions in the chat, Kathy.
I just have one.
Okay.
Can you guys hear me?
Yes.
Yeah.
So my name is Mark. I'm my company is Infinity Healthcare Services. I know we touched on, and we are a home care agency. I know we touched on, a few other businesses, but specifically, do you guys have anything specific to the CHHA program? Because there is a really, really, really bad shortage when it comes to caregivers, when it comes to CHHAs, when it comes to us as agencies, and I'm not the only one. We need to find something or some way to kind of help bridge the gap between the agency and also sending people out to work. So do you guys have something specific to help? Because also too, I have a school, but the issue is that we don't have the people aren't as interested enough to want to actually go through the program. And agencies like mine, because we're so small, we can't afford to turn around and just give out the licenses after they pass. So what have you guys thought about, or is this something on the chopping block to help resolve us as agencies in New Jersey?
Those are great questions, and those are all things that we've discussed with the Essential Jobs, Essential Care Coalition. So I can't answer. I don't know if Jim or Jay could go into more detail about the apprenticeship programs for home health aides, but some of the things that we are working on, I don't know if you've seen we've supported the Department of Human Services put up a Jobs That Care New Jersey website to help people find training and more information. We're also supporting, and this change will start happening over the next couple of months, translation of the test materials into other languages to support people who can't do written tests in English. We've been moving forward on multiple fronts with this. I know it gets complicated because there are so many different schools and trainers spread out throughout New Jersey. But part of the Department of Human Services strategy is also a PSA campaign, just advertising that these are good jobs to take on, especially after COVID, when so many people completely left the healthcare field. We have to reestablish that healthcare jobs are good jobs again. So there are multiple. You are right with all of your questions and all your observations, and there are multiple things in action. It's going to take us a while, but Jim, if you could answer more specifically for the home health workers and the Department of Labor programs.
Yeah, and Kathy, you hit it right on the head. I think internally, as Department of Labor, right, we're trying to help out that process as well, right? And even within our industry partnerships unit, we're going to be adding healthcare as and direct care as an industry focus as well within our industry sectors as well. I know our colleague Howard Miller is on the line, and Howard, I'm not going to put you on the spot, but maybe I will in case you want to. I want to give Howard the opportunity to say anything in case he wants to add anything to that. But I think more specifically on while we help the industry as well, I think it's more specific to the employer. So, Mark, if you ever, as an employer, want to meet with our team, we can help and see what your needs are, help connect. If you have a need to hire for hiring, we can help out the hiring process. But let me see if Howard wants to add anything to that.
This forum, ladies and gentlemen, is probably not the place to really discuss in detail some of those things. So I'm going to take Jim's invitation and say, if you want to follow up, we can do that. But just to parse it out, I think that the Department of Labor has, yes, keenly recognized that this is a needed piece of the healthcare sector. We've been at this from a more global sector strategy piece, right? So as we first engaged healthcare, it was just sort of what is needed overall. And if you can give me a minute here, nurses, this, that, and the other thing, it could include doulas and other type of jobs. As we start to parse that down into subgroups, what we're looking for is we need businesses to engage us so that we can advance those causes. I think we've studied it enough. The next thing is about how to advance it, right? So we're looking at existing programs. How do we apply those? You heard some of that today through Jim's presentation. The next thing is sort of what are the resulting issues around that? So that we can turn around and tackle them in a different way. I think that's sort of the concept around our sector strategies. Address, apply, readdress, reapply. It's a sort of constant sort of referring loop, but that's sort of the general theme.
I agree with you, Howard. I definitely don't think that this is this is something that can't be unpacked right now. But I think just so that you guys can hear it from an owner, one of the issues, it's not about getting the work. getting the workers. We can find workers. The issue is people will not, they'll pass the class, but because of their background, it eliminates them altogether, right? So it's like the problem is not getting workers. You can find workers, but where it is right now and the amount of rules that are in place, there, if people they can't get past the background check. You know what I mean? So it's like, and we have reached out, me and also my wife, who's also on this listening, but we've pretty much gotten nowhere, and everybody's saying the same thing, like, yeah, we're doing this, but if something's not done, then there's going to be a lot of elder people that are not being served. So
Right.
I thank you for answering those questions.
Yeah. And Jake put in the chat the link to, like I said, they're not public, but the recommendations that the coalition has come up with. And if you want to look at some of those, background checks is something that we are pushing for too, because too many people get held up in that. And while you're waiting, you can just walk in and get a job paying the same amount at Target or a big box store. So you're not the only one with that challenge. There are so many pieces to this and so many small hurdles that are adding up to the big hurdles, and we are chipping away one by one. So I invite you to look at the document that Jake put in the link, and if you want to talk with me separately on that to learn more about the coalition, I would be happy to follow up with you afterwards. Just in the to watch the time, I was going to ask Cheryl, can you answer in the chat the questions about CIA and those connections? And then also, how did you continue after the apprenticeship program? How did you continue the higher wages? If you could answer those in the chat, then we're going to move on to Lauren in the interest of time. Thank you. Okay, Lauren, it's all you. And Lauren has been the leader of the workforce committee for our coalition, has had great success with apprenticeship programs up in Bergen County.
All right. Thank you, Kathy. Good afternoon, everybody. My name is Lauren Baruch. I'm the Vice President of Human Resources for the Jewish Home Family, which is in northern New Jersey. We've been in operation for almost 110 years. We started in Jersey City, and then in the early 2000s, we moved up to Bergen County. I think like many of us, we were struggling left, right, and forward. I think the pandemic definitely changed everyone's organization from a caregiving perspective. We all jumped in when the TNA opportunities became available, and then it was kind of like, okay, what do we do now? Especially as the TNAs were coming up to being expired. During literally 4 years ago, almost to the date, we were all kind of struggling. We were getting a lot of phone calls from staffing agencies, which probably no disrespect to anyone on the call. We were trying to get our employees to come back to work. And I, by accident, to be honest with you, I picked up a call thinking it was somebody else. And it was probably a call that honestly changed things for the organization. And it was a business development officer representing Bergen Community College, which is here, obviously, Bergen County. And they were talking about a CNA apprenticeship program, which was in connection with the New Jersey Health Works, which is also connected to the Department of Labor. I can tell you that in the past 4 years, we've had 5 different cohorts where we were able to either use it as an opportunity for staff development, meaning our staff within the Jewish Home of Rockledge or the Jewish Home Assisted Living. But what came along with that, which was so critical for us, was a success coach. And that was someone who was employed or positioned at Bergen Community College who helped expand our pipeline. And because of this opportunity, we were able to not only get our own staff into the program, but we were also able to attract staff that we normally would not have been able to reach. And the question could be, why would there be such difficulty? And that has to do with transportation, which I'm kind of surprised so far has not come up in conversation during this panel discussion. But when you're in an area where there is no public transportation, it kind of makes things more challenging. So as I said, we've done 5 cohorts. When they started with us, they took the class at Bergen Community College. It was a Monday through Thursday class that met from 8 to 1 for a 6-week period. and they actually got paid as they learned. They did have to come on with us as full-time employees, so we paid for them to learn at Bergen Community, but then they still had to do 20 hours a week with us as well. As much as I'm sure some of the students would have loved to have somebody just pay for them and that's it, we wanted to make sure that we became a true partner with them in their career path and help support. And that was a nice team approach between Bergen Community College and the Jewish Home, was that we were all there to ensure the success of the student. Since then, I will say we probably had about an 80% retention rate. Some may ask, you know, is that a little bit low? Is that worth the investment? And in the end of it, I would say 100%. We did have some individuals who, after they became a certified nursing assistant, they left, went, got a job closer to home because transportation became easier. But also at the beginning, I will tell you, and I think Kathy made reference to this, we were also competing with Target down the road. Target, as many of you will remember, they were advertising $25 an hour just to put items on the shelf. And it was really a matter of, with our recruiting piece of it, making sure that we were employing those who truly, truly had the passion of making the difference in the quality of care and the day-to-day lives. And we call our residents elders, for the elders that we serve. I think many of us can relate to this. Healthcare as an industry definitely took a beating during the pandemic. So we've all struggled and everything. And how do we get people to come back to wanting to work in healthcare? Healthcare is a very thriving industry. I think we're all on this panel because of how much we love what it is that we do on a day-to-day basis. I will tell you the pros and cons of what we've gone through. As I said, this is a pro is that this is a staff development opportunity for our existing staff. I remember when we first offered the TNA program, we had several people from our dietary department put their hands up in the air, wanting to jump right in and do something more. And again, of course, it also increased our pipeline with being able to reach staff that we normally would not have been able to. Some of the cons I will tell you, and some of it was spoken about already here as well, but I'm just going to repeat it as more support for it. Longevity, it's a little bit because people want to save on gas. So they want to try to work a little bit closer to home. Sometimes that extra 25 cents or 50 cents an hour has made, a difference. With the workforce that Kathy made reference to, language is a really, really big barrier. And I do think that if they open up the testing to cover more languages, it will definitely also open up our pipeline with our future healthcare workers. I think it was Jim, I'm not sure, and I could be corrected. Correct me if I'm wrong. The reporting piece, it was a con, I have to admit, but at the same time, with the amount of time that it took to do all of the reporting and what you got in the end of it, it was completely worth it because, again, it provided us more access to employees who can provide care to our elders. I'm hoping that we're going to be able to get the languages, the test offered in several languages, because the individual who's speaking before, you're completely correct. The employees are out there. There's no question, but the language is definitely a barrier. I think we all agree that someone where English is not their first language, they are able to communicate with the individual who they're providing service for. And even though you can have the conversation and understand the individual's needs, sometimes seeing everything on a computer, the reading could be very different. And let's also be real. We do have a lot of people out there who also have test anxieties as well. So we're hoping with the work that we've been working on for the 18 months, that it's going to become fruitful for all of us involved. So we have worked on this now for 4 years. Unfortunately, the New Jersey Health Work piece of it, that actually just sunset this month. So we are looking forward to getting more involved in other apprenticeship programs as well.
Lauren, I want to ask you something because I know this has come up in the coalition meetings and someone earlier mentioned retention. And I think that you've said with these training programs and with the apprenticeship model, you've had much better retention, which is cost effective in the long run.
I'm sorry, what is the exact?
So what is your experience with retention when you're using the apprenticeship programs?
Yeah.
How beneficial is that?
We had 80% retention.
Yeah.
Some of it, you know, look, but it's 80%. I mean, I have a number of, you know, certified nursing assistants. Honestly, I would not have had them here if it was not for this apprenticeship program.
Mhm.
And I think sometimes what helps, people think, okay, I live here, 15, 20 miles, it's kind of far with gas and everything. But as they're going through this apprenticeship program and they're working with us, they're getting to know what the culture is. They're getting to truly understand what the mission of the different organizations are. And I think people can honestly see that, you know what, driving that extra 15 minutes to work for an organization that has the same values or the same mission that I do, it says something.
Yeah.
It says a lot.
Yeah.
And that's your opportunity also to sell your mission to this new pipeline of healthcare workers. People
Thank
want
you.
to be recognized. People want to be valued. And when they feel that way, those who get the benefit of it, it's the seniors that we're all here to provide care for.
Yeah. So it's a better match between the employee and the employer.
100%.
Okay.
And Kathy, can I add
Yeah.
one quick thing just to piggyback on what Lauren was talking about, like with the
Sure.
paperwork, one of the cons? So just so it was clear, there's just two things, right? So there's the U.S. Department of Labor process. If you have a registered apprenticeship program, again, U.S. Department of Labor is a registering agency. So there would be obviously information that you need to input into their database for RAPIDS, the name of the apprentice, all that data and all that stuff. So there are reports if you're funded through our gains or PACE, right? So we have a separate database or IGX SAGE grant management system. So some grantees do say, yes, it is a little bit burdensome with some of the reporting because you're reporting it to U.S. Department of Labor, then you're also doing it to New Jersey Department of Labor.
Okay.
But obviously, we need to collect the data so we can report it to our executive leadership and ultimately to the state legislature to keep the funding going. So that helps us gather that data, how many people are served and all that. So there is some administrative burden as far as even being a registered apprenticeship sponsor, but also we do receive grant funding. But the grant funding does, we could help out with some administrative costs a little bit through the grant funding, but that is a real thing. But I don't want anyone to get scared of that real thing. We help you through it, and it's a monthly process. So
100%. And Jim, I'm sorry if I came across that way, but I think you made a comment earlier about having a partner. So the piece that Jim is talking about right now, Bergen Community College actually did that piece for us, which was great. And then there was still the reporting that I had to do on my end. So it's a part. Listen, we're not in this alone. If you're going to do this alone, you're not going to succeed. You need to have that partnership, whether it's with a community college, whether it's directly with the Department of Labor. In the end of it, we're all, and I'm going to sound a little hokey, I think I'm going to break into song. We're all in this together. That's the right. Isn't there that song? But yes, Bergen Community College helped that first piece that you're talking about, Jim. So I was very grateful to have that partnership with that piece of it.
Okay. Thank you. Okay,
now I'm gonna have this song in my head all day. We're all in this together.
Well, if there's time at the end, you can sing it for us, Lauren. That'll get it out of
okay. Everyone's gonna run for the hills with my voice.
So Christine, let's bring you up now. Christine Russo, thank you for joining us.
Thank you for having me. My name is Christine Russo. I'm the Talent Development Manager at UMC, or better known as United Methodist Communities. We have been around for over 115 years, certified Great Place to Work for the past 7. And we have 4 full service communities, 5 senior affordable housing buildings, and we also have a home care division called Homeworks. And like probably a lot of other people that are on this call, we have different levels of care: independent living, assisted living, memory support, long-term, short-term care, and as I mentioned, our home care division also. We have been happy to have participated in 2 grants. I know James had mentioned different financial incentive programs. The first grant that we participated in was during the height of COVID. UMC worked with the Department of Labor on an incentive program that included on-the-job training and a subsidized employment program, which afforded us funds that could be used toward the salaries of our direct care workers that met a certain criteria. With those funds UMC received from the Department of Labor, we were able to use that to provide much needed support to our senior living communities. As most of us know, during COVID-19, there was a substantial added workload placed on all our caregivers. So with these funds, we also had to do testing, COVID-19, donning appropriate PPE, cohorting staff. These were all the issues that were going on during COVID. So these funds that we received enabled us to create a new position called a resident care assistant. And we trained individuals to fill that position, which helped provide assistance to our nurses and our aides in managing a larger workload. In addition, the funds that we received also helped us provide additional staffing and to help defray the higher cost of staffing agency over time. Basically, the way the program worked is we submitted a list to our contact at the Workforce Management. They ran it through their database to see who was eligible to participate. In our case, we were lucky enough to already have current teammates in various positions that did qualify for this program. So we were able to be reimbursed for some of our already current teammates. We used the way the contracts were written. It was an on-the-job training program. We also sent our open positions to them. And we were able to be reimbursed up to 6 figures for our participation in this program. There was, we were talking a little bit about paperwork. We had to send in pay stubs to confirm rates, the hours that they worked, and that they were paid during the contract period. And then we just had to follow up and make sure as the contract period ended that, we moved them out of the program. Initially, we received reimbursement for 24 teammates. And then, as people terminated or the contract period ran out, they were taken out. But 6 of our communities were able to participate in the reimbursement. So we were really happy about that. The program itself offered up to $32,000 a year towards salary for eligible candidates. The basic criteria at that time was just temporarily or permanently laid off as a consequence of COVID, a dislocated worker, a long-term unemployed worker, or a self-employed individual who became unemployed due to COVID. Or if the organization had hired an eligible candidate within the past 6 months, and that's how a lot of our teammates came into the program. So it was a really wonderful program for us. The positives were obviously the amount we were reimbursed from the program. We had really good support from Workforce Management. The negatives, obviously, is, as we mentioned, the paperwork, but in the end, it was worth it. We had to a couple times resubmit our pay stubs several times just by little glitches in the system. And obviously, because COVID was such a trying time, it was kind of a go with the flow, figure things out as we went along process. So that was some of the negatives. The second grant that we did participate in is the one that a few people have already spoken about, is the HealthWorks Apprenticeship Program, which was registered with the U.S. Department of Labor. This program works with the community colleges and employer partners, and it's officially ending at the end of June. It was a CNA in training program. Initially, it offered $12,000 per candidate reimbursement. Unfortunately, one of the negatives for this program with us was that the grant funds ran out. So we weren't able to be reimbursed, but the positive was we were able to hire people through this program. We hired them into our resident care assistant positions so that they were able to work for us. They had to work 15 days prior to the school starting. So we brought them on as resident care associates. We paid them for while they were working for us, of course, and their time that they were going to school. We had mentors. One of the requirements was the mentor had to make at least $1 more than the apprentice, and that the mentor had to be working for 1 year. The other difference, there were some additional things required with the physicals. We had to do a TDAP, MMR, and then we had to do a 10-panel drug screen that tested for marijuana, and that we weren't used to. You know, we don't really consider that, but to be part of the program, they had to be tested for that, but not for our employment purposes, obviously. So it was a good program. They had different classes. Now, originally, I also spoke with someone through Bergen Community College, but because of where our locations were, that wasn't feasible for us. So then we started working with Rowan, which helped at our Collingswood and Pittman communities. And we were able to work with them for classes that their vendors were offered. So for our one location, we started out with 8 in the program, and 5 of them stayed. So 3 stopped the program. We had our nurse mentors and memory nurses selected as our mentors. And then, as I mentioned before, apprentices got paid to go to school. The positives, in the end, we wound up with 9 CNAs between the 2 locations. It was a strong training program. They learned a lot. The college was very helpful throughout the process. Some of the negatives, just a little feedback we heard, they had to do more classes, more modules, even though the program was over. That could have just been, the vendor that we were dealing with. And our one location did have difficulty finding a vendor to teach the class, but they do offer, if you have 10 people at your community that are interested, or, people that you hired, you could have your own class. So that was very helpful. And it was a very well-written program with competency checklist. So overall, we were really pleased with it. And we hope in the future to participate in more grant programs along the way. So if anyone has any questions, please let me know.
Thank you. Christine, just wanted to ask you, how long did it take you to set up that program from when you started until you had the first people going through it?
Well, we first started talking about it. I think we signed the contracts in like October. And then it was just a matter of when the classes were starting. So some of the classes, depending on our location, started in November. We had another that started in January. So it really moved pretty quickly, the whole process.
Okay, good. And thank you, Jim, for answering the question about do people need to stay for a certain length of time after finishing an apprenticeship? And the answer is no, there aren't U.S. Department of Labor standards for that. So I don't know if Cheryl or Lauren, you have any comments on any requirements for length of stay after training?
We've requested that they stay on for a year, but the reality is there's no, we have no legal standing to enforce that. So the request is, and it's not in writing, it's just a conversation that our hope is that they'll stay with us for at least a year. But we also say too, we hope that you're going to be here and we're going to continue to be your career partners, for a very long time.
We didn't have any requirements, so.
Okay. Okay, any other questions for Christine? Okay, then definitely, not least, but our last speaker today is Tori Villafana. If you can unmute yourself. And I think you're going to share some slides too.
Yes, I just want to share, I'm going to share our website. I'm
Okay.
Tori Lynn Villafana. I am, among many things, I am the office manager for New Jersey Association of Community Providers, NJACP. I am also the coordinator for our new direct support professional career development program, which I'm going to share with you guys now. Wait a minute. I probably messed up. Hold on. Okay. Hopefully you can see this. This is our website introducing our program. This program in late 2020, legislation was, excuse me, legislation passed that calls for the establishment of a program of direct support professionals through the New Jersey Council of County Colleges, New Jersey Community College Consortium for Workforce and Economic Development, created to address the crisis level workforce shortages of DSPs in New Jersey. In partnership with the Office of the Secretary of Higher Education, the goals of the program are to recruit and train new DSPs and provide training, higher education opportunities to those in the field or interested in becoming a part of the field. Now, this is the direct support program is supported through OSHE in partnership with Bergen and Rowan Community Colleges. I am the coordinator of this program. I hope this works. Can you see this page for mentorship?
Yes. Yeah, we see you. Yep.
Okay. Well, I'm also the mentor, the lead mentor in this program. And this young lady is with me, Teresa Wilson Fall from Allies, New Jersey. We are the mentors, and this is the program. The program invites anyone interested in becoming a DSP to, they can apply through me or Rowan or Bergen. And I'm the central point of contact, honestly. They can apply through me, through our website here. And I send them to the appropriate people in every community college in the state of New Jersey. And what we're offering is through the state of New Jersey, they're offered either a certificate or an associate degree that are that we pay for. The government pays for it, state of New Jersey, completely. And they offer a stipend for new DSPs, but our CEO here at NJCP, my boss, Valerie Sellers, is working on the wording in the legislation so that we can offer $2,500 to current DSPs and $2,500 to new DSPs, because that seemed to be a little point of contention. They felt like they weren't getting a benefit as much as the new DSPs, but this is all done in an effort to alleviate the workforce shortage. I'm going to play this for you guys. I hope you can hear it. This is our new commercial.
We want to
that
share
did
with you
last
an
week.
opportunity to pursue a rewarding career. Direct support professionals help people with intellectual and developmental disabilities lead rich and fulfilling lives. Welcome to New Jersey's Direct Support Professional Career Development Program.
We need you in our field to support people in our community like me.
Whether you're considering becoming a DSP or you're a current DSP, this program offers educational opportunities for you. Visit njacp.org/DSP to find out more. We want to share with
That's
you an
just one of our
opportunity to
commercials
pursue
that
a
we
reward.
created, and we're advertising on Access Link. We're advertising, we've been to every workforce career development center in New Jersey, from the top to the bottom. We're working with clergy now. And this is a wonderful program that I just wanted to share with you guys, because we have 40 candidates, and next week is the first cohort graduation of 12. And we're just mowing along. We're just moving right along. And there's so many people interested in this program. I would hope that you guys would share this information also. I can share information with you after this meeting. But it is up and running, and the governor was pleased with the work that we did last year. So he has added $1 million in the 2025 budget to continue this program. And that's about all I have.
Well, thanks,
else?
Tori.
And-
Kathy, I think you meant to take your mic off, but while I have that break, I just wanted to chime in to say, I think one of the reasons we were really glad to have you present, Tori, is I think this is the type of state investment in the workforce that we'd really love to see for CHHAs, for CNAs as well. This is a type of program we've seen work in other states like California and Wisconsin that can
And I
really.
think that's where our CEO got the idea, was another state that it was very successful. And if anybody's interested, please, they can go right to njacp.org, our DSP career. There's an application right at the bottom. They can apply right there. It comes directly to me, and I tell them, guide them to where they need to be. And I'm really excited about this. And we've just started with the mentorship component of it, where me and the new mentor that we hired, the central location is right here in Ewing, New Jersey, in our offices, and they can come. They don't have to come in person. It could just be telephone, mentorship. We just want to be there for them. I know I'm a former DSP, almost 20 years, and this job changed my life. I'm back at Drexel now, finishing my degree, and I just know how heavy of a lift it can be to balance everything. So I really wanted to be a mentor to help people know that I understand the tears. I understand the frustration with work and school. It's a heavy lift, especially at my age. But I want to be the kind of person that's there for these individuals, because I do know what it feels like. I do know when you want to give up, I mean, all of us do, but being a DSP, I understand what it takes from you emotionally doing this work. And so I'm really proud of this program, really proud of the program. It's so super excited for as many people to join as possible. And I just wanted to share that with you lovely people today.
Thank
And I'm
you.
not a public speaker. As you can see, I'm stumbling over my words.
Oh, you're doing great. So my question, when I forgot to take off my mic, was I know that on the Jobs That Care New Jersey website that Department of Human Services put up that we mentioned early on, there is information on there as well for DSPs. Can people connect to you through that?
Which one? Which website?
Jobs That Care New Jersey.
Wait a minute. Jobs That Care. I just stole 3 of their videos, so I do believe they are connected to us because I'm putting them up
Okay.
on our website. Jobs That Care. I'm almost certain those are the videos I just took.
Okay, great. I wanted to make sure that was connected. I'm going to put that website in the chat so
Okay.
people can see it.
And they can go direct, and our website connects you directly to Rowan and Bergen county community colleges. But they could go that way, but they would have to submit the application to me if they wanted. They can do that also.
Now, Tori, I don't know if you would know the answer to this question, or maybe Jim knows. Is there a program for DSPs or home health aides to advance onto their RN, the LPN or RN, and take that career ladder?
They've been talking about that because this keeps coming up in this program. They keep talking about CNAs. They keep talking about CNAs. And I'm going to have to speak with our CEO who's out today. I'm going to ask her, because you guys are like the 3rd group I've spoken to, and every single group asks the same thing.
Okay.
And I don't know how this is connected, but I will find out for you guys and get it to Jake, whatever information I get tomorrow, because I'm just not clear on that.
Okay, good, because that is something that the coalition members have talked a lot about, the need for potential for career advancement and career ladders.
And anybody who wants a free college degree, I don't know where you can get it for free. I didn't get mine for free. And this is absolutely free.
Well, we are soon approaching an hour and a half, and I want to ask everybody, are there other questions that we haven't addressed or that you want to put in the chat or raise your hand that we could answer before we go? I think you all answered everything. Jake, do you have anything else that you would like to add or ask?
Just a big thank you to all of you for joining, and especially for our presenters who have been so generous with their time and just preparing for this event to share all this information. I mean, it is so generous of all of you, and we're so grateful to all of you for doing that.
Oh, that's nice.
Yeah, thank you for joining us. We are going to
thank
send
you
out,
guys for having me here. This was very nice. Thank you.
we are going to send out the recording and the links and answers to a lot of the questions. And if the presenters, if you could send me your slides, if you use them, if you don't mind me, I'll send them out as well too. So you had a lot of good information in there. But again, the Essential Care Coalition of New Jersey has been just over 2 years now since we started, and we know that there is a lot more work to be done. But we are exploring every way we can think to help recruit and train and keep people in these important jobs, especially as we know the need is growing. So if you would like more information or would like to join the coalition, I'll send out the link to our landing page and the contact information there as well. Always feel free to reach out to me if you have questions or want to follow up on something else. And with that, I think that's everything. Thank you, everybody, for
Kathy,
joining us.
is it okay for me to send Jake the presentation for me to give to the group? Is that okay?
Yeah, that would be great. Send it to copy it me on it as well, please.
Right, I don't have your email. That's why I didn't want to.
Oh, okay, I'll get it to you.
Oh, thank you very much.
Okay, thank you, everybody. Have a wonderful day.
Yeah.